are you doing today?
Good, how are you?
Good. My name is Christina. I'm going to be your nurse.
Okay.
If you give me just a moment, I'm going to provide for some privacy.
Okay.
Alright, we already did your vital signs. Now I'm going to be performing a head-to-toe assessment, but can you verify your name and date of birth for me?
My name is Rachel Brannon, and my birthday is January 18th, 1992.
Let me check that. Okay. Now I'm just going to make sure I have my supplies. I'm going to wash my hands. Okay. Are you comfortable?
Yes.
Okay. I also need you to verify where you're at, the dates, and the President of the United States.
I am at the hospital. It is August 21st, 2017, and Donald Trump is our president.
Speech is clear, patient is alert and oriented, posture is upright, and hygiene is good. Okay, now I'm just going to inspect your head for any bumps, lesions, or parasites. No abnormalities are noted. Now I'm going to be performing a confrontation test, so if you could just close your eyes and tell me where you feel my finger.
Okay. Forehead, right cheek, left cheek, chin.
Okay. Now I need you to smile. Raise your eyebrows. Okay. Cranial nerves number 5 and 7 are intact.
Okay.
Okay. Now I'm just going to observe your eyes for redness or discharge. No abnormalities are noted. I'm going to be shining a light in your face, so if you could just look at me. Pupils are equal, reactive to light and accommodation. Now I'm going to be testing your extraocular eye movements, so if you can follow my finger without moving your head. Start here. Okay, now follow the middle of my finger. Cranial nerves number 3, 4, and 6 are intact. Now I'm going to be assessing your peripheral vision, so just cover your eye for me. And tell me when you see my fingers wiggling.
Now, 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 now.
Other eye.
Now, 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 now.
Cranial nerve number 2 is intact. Okay, now I need you to say "ah" for me. Okay. No abnormalities noted in mucous membranes or general dentition. Can you move your tongue from side to side? And swallow for me. Cranial nerves number 9, 10, and 12 are intact. Okay. Now if you'll place your finger over one nostril and breathe in, do it to the other nostril. Okay. No abnormalities noted in nasal patency. Can you tilt your head back? Okay. And there are no discharge or deviations. Next, I'm checking the ears for cerumen, discharge, and other lesions. No abnormalities are noted. Okay. Now, can you close your eyes and tell me which ear you are hearing the sound behind? Right ear.
Left ear.
Cranial nerve number 8 is intact. Okay. Now I'm going to palpate your lymph nodes. Submental, submandibular, tonsillar, preauricular, postauricular, occipital, anterior cervical, posterior cervical, and can you shrug your shoulders for me? Supraclavicular. Okay. Now I'm just evaluating your thorax. AP to lateral is 1 to 2. Breathing is even and unlabored. Now I'm just going to go behind you and I'm going to assess your spinal alignment, so if you'll give yourself a hug and lean forward. No abnormalities noted in spinal alignment. Now I'm going to percuss your kidneys for costovertebral tenderness.
Nope. No tenderness.
No tenderness.
Nope. No tenderness.
Okay. Now, if you'll take a deep breath out of your mouth, I'm assessing thoracic expansion. Okay. Thoracic expansion is equal and symmetrical. Now I'm going to test for vocal fremitus. If you could say 99 3 times for me.
99, 99, 99.
No abnormalities noted in vocal fremitus. Now I'm just going to auscultate your breath sounds. Okay. So every time you feel my stethoscope move, can you take a deep breath out of your mouth, please? Lift up this arm for me. This arm. Okay. Breath sounds are even and unlabored. Now I'm just going to check your carotid pulse one at a time. Carotid pulse is strong and even. Now I'm going to auscultate your heart sounds. I'm going to start with the aortic heart sound, which is at the second right intercostal space. The pulmonic at the second left intercostal space. Erb's point at the third left intercostal space. Tricuspid at the fourth left intercostal space. And mitral at the fifth left intercostal space, medial to the midclavicular line. Okay. Now if you lay down for me. Okay. Your abdomen appears flat. Now I'm just going to auscultate your vowel sounds. I'm going to start in the right lower quadrant. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Now I'm going to palpate your abdomen. I'm going to press down on your stomach, so if you can tell me if you feel any tenderness or pain. All right, right lower quadrant,
No pain,
right upper quadrant,
no pain,
left upper quadrant,
no pain,
left lower quadrant.
no pain.
Okay. Have you had any problems urinating?
Nope.
Okay. And when was your last bowel movement?
This morning.
Any problems with that?
Nope.
All right. Now I'm going to just check your arms for edema and swelling. And your legs. Skin is warm, dry, and intact. Now I'm just going to check your capillary refill. Capillary refill is less than 3 seconds, which is normal. You can sit back up for me. I actually need you to stand up, close your eyes, and put your arms to your side. Romberg test is negative. Okay. Now I need you to take 3 steps towards me and 3 steps back. Okay. Gait is symmetrical and even. Sit back down for me, please. Okay. I'm going to test your arms, legs, and neck for range of motion. So if you could just twirl your head backwards and forwards. Your arms backwards and forwards. Okay, and your legs backwards and forwards. Okay. No abnormalities noted in range of motion. Now I'm going to go ahead and test the strength in your extremities. So I need you to push down against me. Push up against me. Push down against me. And push up against me. Okay. Extremities are strong and equal. I need you to shrug your shoulders up against my hands. Push your face against my hand. Push your face against my hand. Cranial nerve number 11 is intact. Okay, now I'm going to test your reflexes. So if you want to hold your arm at a 90-degree angle. So your triceps reflex. Relax for me. Okay. Bicep reflex. And brachioradialis reflex. Okay. Patellar reflex. Bless you. Thank you. Excuse me. Okay. Achilles reflex. Okay. And plantar reflex. Oops, I won't leave that on. Okay. Now I'm going to be testing for ankle clonus, so relax your foot for me. I'm just going to wiggle it around a few times. Okay. Now I'm just going to be checking your pulses. The radial pulse. Radial pulses are strong and even. The brachial pulse. Brachial pulses are strong and even. The popliteal pulse. Popliteal pulses are strong and even. Posterior tibial pulses. Posterior tibial pulses are strong and even. And the dorsalis pedis pulses. Dorsalis pedis pulses are strong and even. Okay, are you comfortable?
Mm-hmm.
All right, I'm gonna wash my hands. And I'm gonna go ahead and document my findings. Your call bell is right here, just let me know if you need anything.
Hi, I'm Erica Tellis. I'm a GEM nursing student and I give my consent.
Come in and wash my hands. Hi, my name is Nicole. I'm going to be your nursing student today. Can I please have your name and date of birth?
Erica Tellis, 7/30/95.
Perfect. So I will be assessing you today. Anything I can do before we get started?
No.
Okay. How are you feeling today?
I'm very happy.
Okay, good. So the patient is smiling. Her mood matches her behavior and her affect. She's giving me eye contact. She's sitting up straight right now. I noticed that she is a female. She's sitting comfortably. Let's see. Are you in any pain at all? So if I say a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain, are you in any pain?
I'm in no pain, 0.
Okay. So 0, rate that no pain at all. If she did have pain, I would assess like where the location is at, the severity, which we already if she would rate it on a scale, the timing of it, what provokes it, if it radiates anywhere, all those kind of characteristics and qualities. I know you mentioned your name and birthday earlier. Can you tell me where we are at right now?
We're in my basement.
Okay, can you tell me the year?
2020.
Perfect. And what are we doing right now?
Head-to-toe assessment.
Okay, so the patient is alert and oriented. She, ×4, she mentioned person, place, time, and event. Okay, then I am going to assess her speech. Her speech was articulate, it was well-mannered, smooth, nothing out of the ordinary is expected findings for her age. And like I said, she was well-nourished and well-developed for her age. Okay, so then I am going to start with pulse. So I'm going to come through here. I'm going to assess for her radial pulse. The rhythm is regular, it's elastic, rated grade as 2+. Because it is at a regular rhythm, I will count for 30 seconds and times 2. And right afterwards, I will count her respirations without her knowing. That way, she doesn't change her breathing style or anything like that. Okay, good. So I counted 40 for 30 seconds, so times 2. So her pulse was 80 beats per minute, which falls in the normal range between 60 and 100. I counted her respiration. She was at 16, which falls in the normal range of 12 to 20. The depth was about 1 inch. It was not labored. Her nostrils or no nasal flaring. She seems to be comfortable at the moment. So now I'm going to be checking your blood pressure. First, I'm going to look at the arm. Don't see any IVs, nothing that I would contraindicate. Is there any reason why I can't check blood pressure on your right arm?
Nope.
Okay, perfect. So, do you know your usual blood pressure?
Yeah, it's 118/78 usually.
So, make sure that I measure. Ladder, it's 80, 40. Measurement for your arm. Make sure that this isn't a category. 2. And just breathe in and out. Let me have you rest your hand on mine so it's at heart level. Okay, it was 118/76. So at top number falling between 90 to 120 for systolic, which is at a normal range, and then the bottom number of 76 falling between 60 and 90, which is normal range for diastolic. So I'll put that away. Next, I will go for assessing the rest of your body now. So when just looking at the patient, her eyes are in line with the top of her ears, the nose is midline, eyebrows and eyes are both symmetric. I do not see any apparent drooping. Head is normocephalic compared to the body. Oval, it's erect. Can you do some facial movements for me? So can you raise up your eyebrows? Can you puff out your cheeks? Can you smile? Perfect. Everything is symmetrical, no drooping. Like I said, everything is even. Okay, so now let me assess for your pupils. So guys, just look straight ahead at me. Okay. Pupils are at 5, which falls between the normal range of 3 to 5 millimeters, which is expected. So now I'm going to check for constriction of your pupils. So just look directly at me. I'm going to shine a light in your eyes. Okay. Good. Now if both of those for direct, your pupils are constricting, can you put your hand in the middle of your head? So now I'm going to check for indirect. Good. Perfect. So both pupils were constricting evenly. Now I'm going to check for accommodation. So just follow my light. So I'm going to break here. Okay. Eyes are converging correctly. So recap, her pupils were equal and even. They reacted to the light with constriction of the pupils, and her eyes accommodated well with converging. Okay, so now I will check for her arm. So first off, I notice that it is light beige. There is some pink undertones, a little redness right there. Lots of freckles. These would be primary lesions. I do not see any scarring or anything abnormal. I'm going to check. Hair distribution is even. Feeling for temp with the back of my hand. Even throughout. It's warm, dry. Her fingers look well groomed. I'm going to check for capillary refill. Comes back within 2 seconds. That is a normal finding and expected. Good blood flow. Now I'm going to check for the profile of her finger. I do not see any clubbing. Okay. Now I'm going to palpate. Just let me know if you feel any pain at all while I'm doing this, especially around your joints. Any pain at all?
Nope.
Okay. I don't feel for any edematous spots. If I did, I would rate that on a 0 to 4 for a scale for pitting edema. Okay, so now I am going on to her chest assessment and thorax. So just looking at her from straight on, I can see that her sternum is midline, her clavicles are even. Chest isn't barreled at all, it's at normal expenditure. It's at expected findings. So then I will check her posterior. Looking here, the patient's shoulders are even, her spine is midline, her ribs are sloping at a 45-degree angle, hips are aligned, nothing out of the ordinary. These are expected findings. So I will come back to her interior side and I will listen for her lung sounds. So before I place this on your chest, I'll try to warm it up a little bit so it's not cold. Just take a deep breath in and out whenever I move.
Okay.
Lung sounds on the anterior side are clear. No adventitious sounds like crackling or wheezing. Her lung sounds seemed even throughout. Right here. Now I'll be checking for her posterior lung sounds. Same thing, whenever I move the stethoscope, just take a deep breath in and out for me. Okay, same thing for her posterior lung sounds. No crackling, no wheezing, no bronchi, clear lung sounds. Now I'll come back this way. I'm going to be listening for her heart sounds. So I will describe each of the spots as I go through. So let me first feel. So, okay, the second intercostal space, the right side is the aortic, so I'll listen for that. Perfect. Heart sound is strong. Let me listen for the second intercostal space on the left side, which is pulmonic. At those two sounds, I was able to hear S2 very clearly. Let me go down to Erb's point at the third intercostal space. I try not to listen over any bone or breast tissue. Okay, at Erb's point is where I could hear any murmurs. There are no murmurs at this time. Now I will be listening for the tricuspid at the fourth intercostal space. And then the fifth intercostal space of the left side is mitral. At the tricuspid and mitral sounds is where I can hear S1 the most clear. Okay, so now that I've listened to all that, I'll have the patient lie down. Okay, so I will make sure that she is covered up. Are you feeling comfortable?
Mm-hmm.
Okay. Normally, if she had a gown, I would make sure that her top portion is covered. So I will first assess for any lesions. I do see a couple moles, a slight birthmark. That is all primary lesions. Noting the color, it is even with her arms, it is light beige, pink undertones, not flushed at all. I'm going to look at for the contour. The abdomen is flat, not protuberant or extended at all. Now I'm just going to listen in all the quadrants. Do you have any pain in your abdomen?
No.
Okay, if she did have pain, I would listen to and palpate that section last. I can hear gurgles and clicks about every 5 seconds, so that would fall between the range of 5 to 30 per minute. So they're active bowel sounds, not hypoactive or hyperactive. Now, sorry, my hands are going to be cold. I'm going to be checking for your stomach and palpating in the starting from the right lower quadrant and going clockwise. No masses. The abdomen is soft and non-tender, and you said there was no pain at all during that assessment. And at this time, I would check for any like fluid spaces, looking for any additional fat, looking if the patient had a fetus at all, or if her stomach was a little distended, it might be due to flatulence or anything like that. Okay, so I will cover up here and check for her leg. So at this time, I'm going to note the color as well. Same thing, light beige, pink undertones, a little more redness around here. I do notice a bunch of freckles everywhere, which are primary lesions. I see that you have a scar, possibly from a past surgery. Is that correct?
Yes.
Okay. Patient has a secondary lesion of a incision scar on her knee. I'm going to check Just let me know if you feel any pain at all while I'm palpating.
Okay.
Any pain at all?
Nope.
Okay. I'm gonna be checking underneath. Skin looks even, feels warm and dry. No apparent wounds or openings. It does get a little colder down to the toes, which is to be expected. I'm checking for heels, nothing open. In between her toes, everything looks well groomed. Her nails look to be expected findings. They're nice and clean. Looking at her hair follicles, they are, I believe the patient shaves her legs, but they are even. Okay, that all looks good. Now I'm going to be checking for the dorsalis pedis. It's a little weaker than her radial pulse. I would grade it as a 1+. It is elastic, just a little less strong versus her radial pulse. Okay, now I'll check for her posterior tibial pulse. Same thing, just a little weaker than the radial pulse. I would rate it as a 1+. It's even and elastic. Okay, now I'm going to be checking for bilateral flexion of dorsal flexion and plantar flexion. When I ask you, or when I put my hands underneath your feet, I'm just going to have you push down for me like a gas pedal.
Okay.
Perfect. And then I'm going to have pull up towards your nose. Good. So the patient feels strong. It's even. Don't notice any differences between both legs. Up here. Actually, one last thing too. Do you feel any numbness and tingling in your legs?
No, I do not.
Okay. If I felt for any numbness and tingling, I would make sure that I know where it starts from, where it ends, where it originally is located at. And I would also note that she doesn't have any edema. Same thing, if there was any edema, I would rate it from a 0 to 4 on that pitting scale. Okay. Then lastly, I'll just make sure the patient is comfortable. While she's laying there, I would check to see if I see any other interventions, like if she had a Foley, if she has an IV, which we stated that she doesn't. The patient is on room air, so no oxygen. Any other devices like that. Make sure that the bed is at lowest position, your items and call light are in reach, side rails are up. Anything else I can do for you?
No, I'm all good.
Okay, that'll be it.